If your health insurance agent doesn't seem like a detective, you should probably get a new health insurance agent. Here's why. We want to ask you a bunch of questions, some of which can sometimes seem a little intrusive, but we need to know these things in order to find out what is the best plan for you and for your family. So let's talk about a few of the questions that your agent should be asking. First off, why do you want health insurance? I mean, this seems like a weird question from somebody selling it to you, right? But what are you looking for? What are you worried about? What are your concerns? Are you worried because your family has this history of breast cancer and you're really horrifically worried that that's going to happen to you? Are you pregnant? Are you considering getting pregnant? Are you just generally healthy and you're looking for something to cover only the worst case scenario? What's your situation? Who all needs to be on your plan? Is it just you? Is it you and a spouse, you, spouse, kids? What does that situation look like? These are going to be questions that if you have a good agent, they're going to ask. Another question is going to be, how long do you need the coverage? And this kind of goes back to, why do you need coverage? Did you just lose your job and you're considering COBRA? Do you have a new job lined up? Are you looking for a plan that's going to last forever? What is the time frame that you're looking for? Also, when do you need your new coverage to start? Are you just shopping around? Is this urgent? What's going on that way? A couple of more questions. Now let's talk about your health. There's a reason why health insurance agents are going to ask this. This is because we want to make sure that if you have a pre-existing condition, it's covered. If you're being treated for, say, diabetes, we want to make sure that you're going to have the best insulin coverage. We want to know what's going on in your health picture so that we can custom make a plan for you based on, again, your health and your situation. Are you in love with your doctor? This is a question that I like to pose because it kind of puts a little humorous spin on it. I mean, I am the happy health insurance guy, right? We want to know, do you have a doctor that you really, really like a lot and you don't want to lose? Because different health insurance companies have different networks contract with different doctors. So we want to make sure that your doctor is in network with the plan that we recommend. And then we're going to get super personal and we're going to say, tell me how much money you make, right? So the reason we want to know about your income is because if you qualify for subsidies on the healthcare.gov plans, on the Affordable Care Act, then we want to make sure you get the best subsidy possible. We want to make sure that you're paying the lowest amount possible for a really good plan. If, on the other hand, you're making a healthy living where your income is going to outpace what the government wants to pay. I like to say, if the government's decided you're rich and now you have to be punished, we're going to want to find the best plan that suits your family. Final question, and this is kind of like that reverse card when you're playing Uno. Final question should be, what other questions do you have for me as an agent? This is health insurance. We want to make sure that you understand your plan. If you have an agent that has not asked you any of these questions or all of these questions or very few questions, you should definitely reach out, get a second opinion on what they're recommending. A lot of the time, agents have really pinned down and they know some demographics about you and they're making a great recommendation. But sometimes, more frequently than I wish, people get stuck in a plan that is going to be subpar for their situation. It might be a fantastic plan, but because the agent did not ask these questions, you're getting the shaft on these and it's just not a good situation. So, what do? If you want to talk to an expert, there's a link in the bio in the description. You can hop right over to my website, schedule an appointment to meet with me or a member of the Happy Health Insurance Guy team. I'm Norm. I'm the Happy Health Insurance Guy reminding you, stay happy.